the question deals a lot with some of the advancements in the 2018 cardiovascular risk assessment guidelines. In those risk assessment guidelines, we initially started off with the idea that about 80% of all heart attacks and strokes are probably preventable by optimizing lifestyle habits. And then we emphasized the concept of lifetime risk, where if someone has a risk factor such as cigarette smoking, high cholesterol, high blood pressure, their 30-year risk is actually pretty high. And the next concept was the idea that we can do a better job of personalizing one's risk. So in the guidelines, we kept the concept of a 10-year risk estimate of a person's chances of getting a heart attack or stroke, but we improved the guidelines a lot by including what we now call risk-enhancing factors. So if someone has a family history of premature coronary disease, if they have the pre-diabetic state or the metabolic syndrome, if they have persistently high triglycerides, if they have an elevated lipoprotein a, these are factors that might lead the doctor and the patient to decide to start a cholesterol-lowering medicine sooner, and also to further improve their dietary and exercise habits. And then we brought back the concept of intermediate risk and expanded that so that essentially if someone has anywhere from a 5 to 20% chance of a heart attack or stroke over the next 10 years, studies led by Dr. Khurram Nasir and Michael Blaha have indicated that about half of those individuals actually are at extremely low risk of a heart attack or stroke because they have no coronary calcium. And it's important to realize that with the tests such as selective use of imaging with a coronary calcium scan, you can pick up younger people who may not have been old enough to qualify for intermediate risk status. Or you can also pick out the patients who are probably at very low risk over the next 10 years. So I agree that personalization of risk assessment at an earlier age is probably a key factor in ways to try to lower those bad statistics that you mentioned before of so many people dying of sudden death without even knowing that they were at high risk for heart disease.